Well, good morning. When I first stood at this podium 1 year, 1 month, and 15 days ago, I explained that in the face of a global pandemic swiftly killing thousands of people in cities around the world, and in the absence of a vaccine or a cure, we would have no choice but to utilize the same tactics humans had employed a century ago and on many occasions before that. Keep our distance from each other, don't gather, wash our hands, and eventually wear a mask so to minimize how much we literally spit the virus on each other. As you well know, 4 months and 16 days ago, a vaccine for COVID-19 arrived in Oklahoma City. Since that day, hundreds of thousands of our metro residents have received it. As a direct result, new daily cases have declined 90% from their highs, and hospitalizations have declined by a similar percentage. At our worst times this winter, we had 1,000 new cases per day in Oklahoma City and over 700 people in the hospital for COVID-19. Now we are averaging less than 100 new cases per day and have at times this week dipped below 100 hospitalizations. COVID-19 is still a part of our lives. It is still a challenge to our collective health. But vaccines have changed the conditions dramatically. Our challenge is different now. And as such, today we move fully into a new chapter of our pandemic response. As you likely know, Oklahoma City's ordinance requiring a mask to be worn in indoor public places has expired. Most of the suburban mask ordinances have already expired. Tulsa's mask ordinance expires now as well. Of course, private businesses may still require masks, and it is our legal obligation to comply with their requirements if we wish to enter their private property. That's the law and always has been. But moving forward, such requirements will be up to property owners. Additionally, I will sign a proclamation after this press conference ending our city's state of emergency that commenced March 15th, 2020. There have not been any restrictions associated with that state of emergency since 2020, so this act is largely symbolic. You likely didn't even remember we still had a local state of emergency in place, but we do. It needs to officially be lifted, and our legal staff felt that ending it in conjunction with the expiration of the mask ordinance was appropriate. Keep in mind, there is still a statewide state of emergency, and these emergency classifications at different levels of government function differently and for different purposes. My action today has no bearing on the statewide emergency. The role of municipal government in halting the spread of the virus has now ended, as it was always meant to. The opportunity to enter this new chapter is a sign of success, and we should be happy. It is, of course, not a sign of finality. The virus is still with us and may be for a while. But with a vaccine now widely available, the ongoing response will be led by public health officials, as with all other public health challenges we face. Before I yield the stage to our chief public health official, let me conclude with some thoughts about vaccinations and some gratitude. First of all, it is possible we are capable of taking the miracle of vaccinations for granted. These proven safe vaccines are remarkable. They were made available to the public in just 9 months. They are free, and they are now easily available to all adults in our Oklahoma City community. I became fully vaccinated last week, and I consider my life to be changed. The possibilities for me are now, once again, endless. There are literally billions of people around the world who wish they could say the same. As you watch me speak these words right now, you are just a click, a phone call, and a short drive away from your vaccination, something that people around our planet are desperate for. So if you have not started your vaccination process, please don't waste the amazing opportunity that is being given to you. So many people around the globe would love to stand in your place. At this point, with vaccinations easily available, if you get sick with COVID-19, if you go to a hospital or worse, you die, all because you chose to not get vaccinated, that would really be a tragedy. Though we still have some work to do on this pandemic, I recognize that declining trends and rising vaccination levels mean it is entirely possible this may be the last time I speak at this podium under these circumstances. If so, I would be remiss if I did not take a moment to thank our Oklahoma City County Health Department, led by Gary Raskob and his board, and Dr. Patrick McGough and his team. I want to thank the city manager, Craig Feeman, and his team, especially Kenny Sudel, Frank Barnes, and the emergency management staff, and our public information office. Thank you as well to our municipal counselor's office and all city employees and first responders who have been on the front lines of this pandemic response. Thank you as well to the Oklahoma City Council, the mayors and council members and city staff in our suburban communities, the Oklahoma County team, Mayor G.T. Bynum, and our partners in Tulsa. Thank you to Governor Kevin Stitt, Health Commissioner Lance Fry, and his state health department team, and all state employees and elected officials. Thank you to our federal elected officials. Thank you to our business leaders, our chambers, and Bruce Lawrence, who advised me at critical times and was a liaison to our business community. Thank you, of course, to our healthcare professionals, who did so much and made so many sacrifices in some of the darkest days of this pandemic. Thank you to our teachers and other education staff. Thank you to our faith leaders. Thank you to the members of the media. Thank you to every single person in this community. We have all been in this together and will certainly carry this shared experience forward with us for the rest of our lives. I'll certainly never forget this year of my life, and thank you for all your support of me and my family. When I asked to be your mayor, I asked for these responsibilities, and I consider fulfilling them to be the greatest honor of my life. But I could never have done it without you and your support. The countless messages of encouragement I have received since March of 2020 have meant the world to me, and I hope you know that. And of course, thank you to Rachel, George, and Maggie for always being the lights in my life. As I turn things over to Dr. McGough, I'm not just turning over this podium. This new stage in our response is one that will be different, and it will be led fully by public health. We'll all remain vigilant, and if something unexpected happens, we know what to do, and I will always respond when thousands of lives are in immediate danger. But today, with the lifting of the emergency and the expiration of the mask ordinance, there is no question we are entering a new chapter. And we have no better team leading us into that chapter than this group of brilliant, hardworking, practical public health professionals here at our independent Oklahoma City County Health Department. They carried us through this remarkable challenge, and they will continue to carry us through the months that lie ahead. Dr. McGough, the stage is yours.
Thank you very much, Mayor Holt. I appreciate the opportunity to visit with the public today. We have something incredible to celebrate, and so while the pandemic is certainly not over, I want to congratulate all of the healthcare workers and all of the people involved in this pandemic response, because we have now administered more than 500,000 vaccines in Oklahoma County. That's an incredible landmark, and it's thanks to you, the citizens of Oklahoma City and Oklahoma County, and many others. And I will try not to forget anyone today, and I will be going through a list of people that I want to thank, but I just want to start off with how wonderful it is. And though this pandemic has been the hardest year of my life, both personally and professionally, I am so thankful for all the good that has happened. We have seen so many people coalesce and come together from every sector of the community to help protect individuals, to save lives, and to do what is best for our community. And for that, I'm so very thankful. So even though I've whined and bellyached from time to time about how complicated this year has been, and it truly has, I've lost loved ones. I took a job as an executive director of the health department right before a 100-year pandemic. And it was really, really incredible. But there have been so many people that have helped along the way. So I want to talk about that a little bit today. We could not have reached this milestone without our healthcare systems. So I want to thank very loudly and boldly Mercy, OU, SSM, and Integris, and also our FQHCs. In particular, I'm talking about Variety Care and CHCI and OHA, among many, many others. And I am particularly grateful to nurses, as I am a nurse, and you know the nurses have been on the front lines of this in our healthcare systems and here at the health department and at our mini pods in the testing and the tracing and then the vaccinating. And so kudos to every nurse in Oklahoma City and Oklahoma County who has worked tirelessly throughout this pandemic. Thank you, thank you, thank you, and especially to our physicians, our support staff, and to our volunteers. There's also another group of individuals that is frequently behind the scenes. I know that everyone knows who Mayor Holt is, and he's been amazing, but his team as well. And I want to mention several of those, and I have actually written them down because I didn't want to leave them out. But J.D. Baker, Steve Hill, and Karen Fox, thanks to you for everything that you've done through this process. And also to Christy Yeager. I also want to mention City Manager Craig Freeman and his team, in particular Amanda Carpenter, Kenny Sudel, and again Christy Yeager. Thank you for what you've done with this pandemic and how you've helped us to reach the needs of the community. I want to go back to saying that the ultimate goal is that every individual that's 16 and older in Oklahoma County would be fully vaccinated, and we are not there, but we are well on our way thanks to you. And Mayor Holt mentioned that vaccine is widely available. Our pharmacies have it, our private physicians have it, the hospital systems. I mean, if you want a vaccine, it's readily available. If you need help getting it, please call our hotline. And if you need to register for it, vaxokc.com is still there and still active. We have a number of stories that we could tell that are heart-rending about the lengths that individuals have gone to get a vaccine for themselves and for their families. And we want to just thank those individuals, and I am very thankful and appreciative to all of the minority populations who have worked tirelessly with us to make sure our diversity and inclusion efforts were successful throughout this vaccine pandemic response. I am truly, truly indebted to them forever, as is our health department and our community and the citizens of Oklahoma County. Excuse me. We remain cautiously optimistic, and we will continue to watch the data closely. And in particular, we're talking about our sewage surveillance, which gives us 2-week lead time on when cases or variants in a particular area may spike. And I'm very thankful that we have a team of epidemiologists, we have researchers, we have all kinds of individuals that are true scientists that understand what is going on and that can make sure that we alert the elected officials and all of those who need to be aware in a timely fashion so we can address it appropriately. Excuse me, I'm having some sinus issues this morning. I want to close again thanking some individuals that we have not mentioned so far, and I want to thank the Oklahoma City Council for all of the work that they have done throughout this process in saving lives and in protecting our community, not just in the healthcare, but also in the financial arena, protecting our businesses and trying to look at what was good for all of our citizens. Our city councilors and elected officials actually across all of Oklahoma County, so thankful to them for their help. We've seen, in a lot of things that have been made somehow political on a national level. Here locally at home, I've seen a very bipartisan desire for people to work together, and it reminded me of Mr. Rogers. We were looking for the good and looking for the helpers, and they were everywhere. And so I am thankful for the Oklahoma Standard, and I want you to celebrate that with me today as well. I am thankful to our Oklahoma City County Board of Health for all of the efforts that they've given. They are a voluntary board, and they have made sure, and their primary role is to make sure that we have the resources to protect our community and that we're expending those resources in the right way. And we have been able to do that, and we're very thankful for that. And I would be remiss if I did not say thanks overwhelmingly to the Oklahoma City County Health Department Emergency Response Team and to our executive team and to our entire staff for tirelessly working throughout this pandemic. Our work is not over, and as LT Knighton has continued to tell me, we're cautiously optimistic, and that is still where we are, but I am very excited and just thrilled about the fact that we have reached the vaccination levels that we have. We have work to do, and I want to say one more time the greatest thanks to Mayor Holt. It has been incredible, and it's been an honor to work with him through this. We will continue working together, but hopefully not as often and not as frequently. I'm sure he's probably tired of my texts and emails and phone calls, but it has been an honor to work with him throughout this pandemic, and I am so thankful for all of the individuals actually that I had the pleasure of working with thus far. It's made my job so much easier. On a more somber note, I would like to end talking about servant leadership, and if I can get through this, then I'm going to do my best to do that. But today I want to thank my family, my wife, Cynthia McGough, my son, Breck McGough, and my daughter, Keely McGough. They have been my mainstay throughout this incredible time. But I want to also mention my mother. My mother passed away this week after years of chronic illnesses and battling a number of diseases, including cancer. And at the beginning of this year, she already knew she was terminal. She had weeks to months to live. And so she and I were talking, and I was trying to get her to understand the importance of taking the vaccine, which she did, knowing that she just had a few weeks to live and that really, if she got COVID, what difference was it going to make? But what she was excited about when we discussed it was that if she got the vaccine, it would protect her children, her grandchildren, and all of the circle of influence, where they go to work, where they go to school. Everything that they do mattered. And that one life, because she took the vaccine, she has had countless of doctor's appointments and countless encounters with healthcare systems because of her condition. A number of procedures over and over, people coming in and out of her home. But because she was vaccinated, I truly believe one individual was vaccinated, she saved countless lives. And she has always been a servant leader, and even in death, she was taking care of others. And so today I want to honor my mother. Her name is Sue. And I am thankful that she bothered to do what was best for others as she was dying. And it wasn't like this life goal of her that she was doing that. It was just what came natural because she was a servant leader. So be like Sue, get your vaccine, and take care of those that you love. Thank you. And with that, we will take questions.
What plans are in place to ensure that homebound people can receive a vaccine, and how can they go about calling to arrange that?
Sure. So we have a list of most of the home health care agencies that deal with the homebound are now vaccinating their people. As long as they've signed up to get vaccine, they can get that done. But we also have a list that if they're not associated with one of those groups, they can get on our list, and then we'll try to see what we can do to try to accommodate that. And that's 425-4489. That's the hotline.
Are there questions, guys?
Hello, this is Christine over at KOCO 5 News. This really feels like a celebration, a closure, as you will, for this pandemic. You guys mentioned that there is still a lot of work to do. My biggest question is, what is that next hurdle that we need to get to as a community in order to ensure that this pandemic is over for our city?
Well, it's definitely vaccination. I mean, we have to continue to try to get as many people vaccinated as we can. We're still trying to hit that herd immunity status. And at least here in Oklahoma, we think we need to hit 70% vaccinated, because we know we have a pretty good percentage of people who also have natural immunity from already having COVID. So that's where we're trying to get. The vaccines are effective. We just need to get people to take them.
Anyone else?
Quick question, what would be your message to folks about when it might still be appropriate to wear a mask even though the ordinance has expired?
Well, the message now is, we've done a really good job up to this point. Our conditions are way better than they used to be. So now it's be smart. It's when you walk into a situation where you're around a lot of people that you don't know if they're vaccinated or not, put your mask on. We're not telling you have to wear it all the time. Wear it when you need to. So, people are smart enough to know when they need to do that to protect their families or to protect the others around them. So It's just be appropriate. Keep up to date with the CDC mask guidance. You can keep up to date with our website, and we will have those recommendations on there.